As a med technician, I put a lot of IVs in and I take a lot of patient IVs out. Patients don't usually like IVs because they don't like to get poked. It's not very fun, and I agree. IVs are used to give medications that they need for infections or anything else, but most importantly, it's used to give life-saving medications if in the event that you are in distress. So, I'm Kaya Glover, and I'm going to talk to you about how to place an IV and how to take an IV out. So, I'm going to talk to you first about the different types of IVs we carry, or most hospitals carry. I'm going to talk to you about how to place an IV, and then I'm going to discuss how to take one out. So first things first, IVs come in different colors and different sizes. The size ranges from 14 gauge all the way to 26 gauge. The 14 gauge you would think would be the smaller needle, but it's actually the largest one. And it's a large bore needle that is used to mostly give blood or take blood out. The 26 gauge is usually for pediatrics or patients that don't really need IVs, but we need to have access anyway, and they're really small. Next, IV are color coded, so you can't really get them mixed up. They're universal throughout the system. I'm going to show you a chart of the different IV sizes. The color is in black and white, so forgive me. So as you can see, the chart shows you the different IV sizes and the needle length of it, and it just tells you exactly like the diameter and the color that needle is. So each IV type is used to help do the ultimate job of providing you medications in the hospital. Next, I'm going to talk to you about how to place an IV. It's really simple, really easy. And the things you really need is an IV, like the IV catheter, alcohol swabs, gauze just in case, your tubing for whatever medication they might get, and whether it be just running fluids or it's just going to saline lock it, which is just keeping the site patent. You're also going to need saline flushes, which is just salt water. So first things first, you're going to introduce yourself to the patient and wash your hands and don gloves, and then you're going to explain the procedure to the patient of why you're giving the IV and what they need to do. Next thing you're going to do is put a tourniquet about 2 to 3 inches above the site that you want to do. If you're doing the arm, just go 2 to 3 inches above the elbow, and then you're going to feel for the site. Lots of people think that, oh, if you just see a vein, that's just the vein you can go to, but you really need to learn how to just feel for the vein and know what a vein feels like. It feels like a sponge, so it's going to be bouncy. If it's not bouncy, it's probably not a vein, and it may be something else. So after you feel for the site and you know what site you're going to use, some people take the tourniquet off and give the arm a rest, or some people leave it on just to help the vein protrude a little bit more. Then you're going to clean the site in a circular motion, cleaning out from the inside out, and then you're going to proceed to get all your belongings ready. So you got the IV catheter, and you'll just take it out of the packaging, make sure that the plastic part of the catheter is loose, so when you try to proceed it to go into the vein, it will go in smoothly. After you do that, you're going to tell the patient that they may feel a little poke, and then you're just going to go in at a 45-degree angle and insert the needle into the vein. Don't do the catheter, because the catheter is plastic. It will not break through a vein. Make sure the needle is up and the bevel is up when you push it through the vein. Once you get flashback, then you're just going to stop advancing the needle and just advance the plastic part. After that, you're going to undo the tourniquet, hold pressure above the site so when you pull out the needle, the patient does not bleed. or bleed very little, and then quickly connect the medication or the tubing to the IV. And then just to make sure that you got it into the vein, you're going to take that saline flush and you're just going to flush it. And that's it. You have an IV. Make sure you dress it. When you dress it, make sure you just put a plastic covering, we call it Tegaderm, over the IV site so you can see exactly where the IV went in. So if it infiltrates or has any problems, we'll know. And then you're just going to put your name, date, and time on the IV so people know exactly who put the IV in, what time, because IVs can only stay in for about 4 days before they have to be replaced. So I'm going to give you a visual on the IV and parts of it, okay? So this is what the IV looks like. Up here is the needle all the way at the end, and then over it is a plastic covering part. When I say advance until you get flashback, the part I colored is the flashback chamber, and you'll see blood in there once you advance it. And after you do that, you're just going to use this grip and advance. Pull out the needle, because this is a safety needle, this example. And then the catheter will stay in. So, you've put an IV in. Simplest thing to do after you put an IV in is to take it out. It's so easy. All you have to do is take alcohol, because the stickers really stick. They are very sticky. So, in order to ease the adhesion for the stickers, you just want to rub alcohol around it. It usually makes it a little bit easier and a little less painful for the patient when you use alcohol to take the dressings off. After you do that, grab some gauze and slowly pull the needle out, and then hold pressure once it's all the way out. You want to check the plastic catheter part to make sure it's not bent or anything, because then we want to make sure no parts of it is left inside the vein. After you hold pressure, just tape it with some regular tape, and you're good to go. And that's how you take it out. Very simple. It's a lot easier than putting one in, don't you think? Well, I'm glad that you guys listened to my video. I hope you learned a little something about what happens and what goes on through the medical technician's mind when we're putting IVs and when you come to the hospital. So I hope you learned something, and I hope you take this with you when your next hospital visit. Thank you.